Williams, and today I'm going to be talking to you guys a little bit about maternal depression. Maternal depression knows no color. It's there regardless of age, race, ethnicity, and economic status. Some of the symptoms of depression during pregnancy can be low birth weight, stillbirth, preterm birth, and also maternal morbidity. And some of the symptoms of maternal depression would be mood swings, trouble sleeping, anger, irritability, and also a feeling of worthlessness. Usually having a baby can be the happiest time in somebody's life, but it can also turn into one of the worst, depending on the type of depression we go through. There's 3 types of depression. We have perinatal, maternal depression, postpartum depression, and also postpartum psychosis, which I'm going to be going a little bit more over today. And the research from Journals of Women's Health and the National Institution of Women's Health assisted me in some of the facts that I am going to be giving. In relation to depression, I also have dealt with some of the symptoms of depression, such as anger, irritability, feeling of worthlessness, poor hygiene, crying to myself, different symptoms that are related to depression, and also ways that I got out of this was just different sources of treatment, self-love, attending family gatherings, and just being with my baby, present with my baby as well. Getting outside of the house and getting assistance to create just a bit of stability to keep myself just a little bit above water. And the main points in relation would be that I'm going to be going over today is the depression in moms, maternal depression in mothers. What does it look like? Is it easily evident? The causes of depression, and also the various treatments that are available to mothers with depression. First, I'm going to be going over what is depression, what does it look like, and is it easily evident? The answer would be no. Depression could be your neighbor, the person walking in the store, someone in the car driving next to you. You never know. Depression is, like I said, it has no color, age, race, ethnicity. It's all women. All women can be affected by it. Depression can strike also at any moment. And maternal depression may affect the connection with the parent and the child, and it also affects the development of a young child as well. The Journal of Women's Health states that 10% of moms experienced depression in the last year. And within this 10%, this study, it was moms that were white, Native American, low income, that felt the symptoms of depression the most. There's 3 types of depression that I listed earlier. It'll be maternal depression, perinatal / postpartum depression, and also postpartum psychosis. Postpartum psychosis would be the worst of these 3 types of depression. Postpartum psychosis, the symptoms of that would be paranoia, mania, confusion, hallucinations, and delusions, and it's considered the most dangerous. If a woman is going through postpartum psychosis, it can be very harmful to not only the mother but also to the child, so it is very important to seek treatment immediately if you can. Moms that usually go through depression, like I listed earlier, I listed a couple of them, but here's a few more. It would be teen moms, low income moms, moms with lower education, and mothers that have previously dealt with depression. And studies suggest that African American mothers and Hispanic mothers are the highest at risk for overall depression. Next, I will be explaining different causes of depression in mothers. There's various causes. There's no single thing that can cause depression. It can be environmental and genetic as well, but some of the causes would be not having enough education. Teen and adolescent moms experience depression.
Aiden, come sit down.
Experience depression the highest. And also low support and lack of resources is also a contributor to depression in mothers. Excuse me. Research from the Reproductive Health says causes are but not limited to lack of support, during and after a pregnancy, and also negative family dynamics when someone is forced to become a single parent, and also when someone is forced into sexual activity that resulted in a pregnancy. A single mom story that I am going to be sharing with you guys today in relation to depression is about a woman named Leah Campbell, and the title of the story is "I'm a single mom, but I do not have the luxury to break down." And in this story, she goes over different causes of her depression, how she used her daughter as her motivation to, like I said, just stay above water so that she can be that positive role model for her daughter. She can be positive for her daughter in her daughter's life. And one of the lines from the story is, "It came over me often at night, after my little girl was asleep, after my work was put away, after my computer was turned off, and after all the lights were out." She described this as being one of the moments that she had her most negative, intrusive thoughts. She had the most symptoms of depression during this time. And I believe this is relatable to any woman. I know, as myself, lonely in the dark, having nothing to get my hands on, only being left with my thoughts sometimes is not the best. You have negative thoughts, you're not thinking, you have a negative self-image, and these can affect you and cause depression. Like I said, I believe it's relatable to every woman. Other causes of depression would be being a single parent, like I said earlier, or being forced to become a single parent, hormonal imbalances, no child care, no support, no financial stability, familial stress, and even toxic environments can cause anxiety and depression. Perinatal depression specifically is usually caused, it's genetically caused and environmental, meaning it can just be in your mind. It's passed down. It's a symptom that you usually cannot get rid of. These types of depression usually takes some type of therapy to get through, but it's possible. According to the healthandsafetychildren.org, the risk of developing perinatal depression is also higher for women that have previously dealt with depression prior to their pregnancy. Last, I would like to go over the treatments for maternal depression. There are various treatments out there that are government-based and that are individual that you can go for yourself. Treatments include therapies and medications. The therapies would be psychotherapy, cognitive behavioral therapy, interpersonal therapy, and medications such as antidepressants. There are some objections to therapy and antidepressants. Some of the objections to therapy would be feelings of weakness, feeling like you're going to be judged. The person that you are talking to does not have good motives or your best interest in heart, and overall just lack of trust in the therapist. People tend to object because of that. They tend to pull to peers, family members, co-workers, people that they know that are there to support them if therapy is not available. Also individuals state that therapy is also not affordable, even if you do have insurance. And something that some of our states are doing, South Carolina and Tennessee have extended their Medicaid program to assist mothers with postpartum depression, and this is up to 12 more months. This is assistance, financially, assistance getting counseling, childcare, therapy, everything that you need when going through postpartum depression. Again, it's in South Carolina and Tennessee, and I believe this is something that all states can benefit from. Some more of the more Macro solutions would be parenting classes, community resources would be more of on a bigger scale. Again, government assistance is available. Looking into it, they do have classes and they do have certain assistance with child care to help you. Financial assistance also to assist mothers that may be going through depression or a hard time and needs the help and the support. Some micro solutions, something that you can do for yourself, is just self-care, advocating for yourself and your children, and also talking to your healthcare provider and being very honest during your during the mental questionnaire that they usually give you in the beginning. Sometimes we fall off of it. We don't want to be honest. We're scared that they're going to think that they're going to judge something of us, when it's very, very important. If you feel that you are going something, be honest, and you can receive different resources in the care that you may need. The British Medical Journaling Publishing Group stated that intensive postpartum support provided by a healthcare provider usually has the best results. So, like I said, talk to your doctors and be very, 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 very honest during the mental questionnaire / survey that they give you. Early interventions and awareness is also important when dealing with the risk factors of depression. Knowing the signs and knowing how to support people that you might feel are going through depression. In conclusion, depression can affect all mothers. Like I said, it's here regardless of age, race, ethnicity, economic status. Low income, high income mothers are affected. They may be affected in different ways, but all mothers can be affected by depression. Having recognition of these stressors is also very important for mothers and individuals that are interacting with them and their children, so that they are able to provide proper support. And support is not only from your peers, your friends, your family, and your close inner circle. It is also from your jobs, from your physicians, from co-workers, from your community. You need the support. Mothers need the support. And I know in becoming a mother myself, without certain support, without family being there with me, without some assistance to create some financial stability, I know that I probably would have not turned out the best for me and my child. So, and that is all that I'm going to be talking to you guys today about. Thank you.